Okay. So we really wanted to do this bonus training because we are just really all about like implementation, and we love to be able to teach something that you can really utilize tomorrow. So, we really like to streamline documentation and talk about all these documentation strategies. So we're going to be doing a lot of that tonight, and hopefully you guys all get a lot out of this. And yeah, let's get started. We're also going to be having a ton of prizes. We're going to be announcing the scholarship winner. So a lot of exciting things tonight.
All right, we want to start off by saying also don't forget to download your Summit workbook. So when you go into your library, so you log in to Kajabi, either from the login on your computer or your phone, you could do the app, and the workbook is on there because sometimes last time a lot of people did miss it. So Nicole has like just circled and everything because there's a lot in there. When we were first planning on doing it, it was just going to be like a couple key points, but it really came out with a lot of extra stuff. There's extra resources at the end, so just make sure you also check that out along with the presentations.
Okay. So just want to go through our speakers real quick. So here were our day ones that we categorized. So we had absolute powerhouse speakers, and we're we just feel really proud of the summit and all of the people that came together. We really couldn't have not have done it without them. So here are our day one. We had JJ Mauder, we had Mandy Chamberlain, Hong Tran, we had us, we had Kyle Womack, Phyllis Goldstein, all just incredible people with all different great information that they were able to share with us on all different topics that we could, learn from for our older adults. And then we had our day two. We had Chris, Rachel, Megan, Shatil, and Lisa, us again, and then we had our aquatic therapy team from Canada. That we were
I'm just gonna have to wait till I'm done with this.
Oh, make sure you're muted. I don't know where that is. Okay. Yeah, great day two, great powerhouse speakers again. And then day three, we had Kara, Alex, Ashley, Helena, Malene, Tara, and Kylie. And then once again, us. You got 3 presentations out of us because we really wanted to do our best to make this 20 contact hours. So hopefully you all took a lot out of them. Yeah, if you have a favorite, make sure to just let us know here so we can share the love and let them know that you really enjoyed their presentation.
Sure, if you liked them too and you tagged them on Instagram or something, they'd be happy also.
Yes,
that's where most of them could be found.
Yeah,
so.
absolutely. Yeah, feel free if you are in a presentation and you don't really like what you see, feel free to like take a screenshot, tag it on your Instagram story and tag them in it, tag us. We just absolutely would love to see it. So thanks.
All right, so don't forget, we have the scholarships. So we're gonna announce the winner at the end. It is closed. Nicole did a whole little wheel putting everybody's name in it. So that was just because we just want somebody to win it that we know is going to use it. Sometimes people, like if we put everybody's name in, people don't pay attention and they don't even realize what they're winning. So we just wanted somebody to win that. We'll use it, but that person doesn't have to be here, but we are doing other prizes along the way too. So.
Okay.
So this is just a quick overview of what you're going to win. So like we said, it's a year to the Ninja membership. These are all our different categories. We have basically, I think we've been doing it for like 4 years now, the membership, and we add to it monthly. So there's just a lot. These are all the different pages. We have documentation banks. We have different categories. We have goals. We have
a new AI assistant.
No, we have
a lot of videos in there. So that's what the scholarship winner is winning. And that's a lot of you actually opted into the free trial too. So if you have not signed on yet, you're really missing a lot of things. So make sure you go in and then just ask us if you have any questions, need help navigating, just let us know. All right, so let's get to our training. We don't like to, talk too much fluff or waste time. So we're going to talk about how to build a template. So we're actually going to walk you through how to build this and then show you some additional training tools as well. Okay, so we understand that, you might not be a fan of a template because they might seem too generic, or maybe you prefer to free type everything. You just like have so much you want to write and you just want to do it your own. Maybe your setting is unique, templates don't really apply, or your EMR limits characters. We've heard it all. So we're going to give you the case to why you should be using templates.
Okay, so why templates work. So there's just so many ways you can do it. You can have drop downs, you can have, so our whole thing is we use drop downs or we have like lists, so we can really make it patient specific. We think of every way that our patient can present and what we can do to help them and just all different things and just like list it down. So we're just not rewriting the same thing every time. Like there's only so many ways you can present for certain activities. And I mean, you could always rewrite if something was crazy, but there's a lot of the same things. So we just really just brainstorm it and just over time, this is how we started doing it. We worked together and we used to do it together. So this is like 10 years of just brainstorming, dumping ideas into a template.
It also, it takes, it allows you to prompt clinical reasoning without the guesswork. So you can use, use it for queuing, for progression options, strategy banks. You really can create a template into anything you want it to. But for me personally, like I always struggled with the clinical reasoning behind, like, why am I doing a ball toss with a patient? I know that there is a reason. I'm working on the balance. I'm working on coordination, bilateral coordination, all those things. But really to see that in a template and just have it there when I'm treating 8 patients a day, to have that all there is just so much more, it's just easier for me to really see that I'm doing and that it is medically necessary. So it really just helps you to write those defensible notes a lot faster.
Yeah. Yeah. That's bad.
For
Please, if you haven't, sorry.
So it's flexible for all settings. You can make this no matter what setting you're in. So we just found it so easy, like we said, just to make sure we have everything in our notes. If you have it structured out in a template, you know that you're putting everything in because you can just say what the patient did. You have to also say your reasoning and what happened. And just having that structure helps to make sure you have it. And even if your notes were to get scrutinized or audited, you would know, you would feel confident that everything was in there. So that's why we like to do those. And like we said, it can be used for all different settings too.
They're also optimized for real world use. So you really can, make them concise and audit friendly. You can, add outcome measures in there, skilled phrases, and, really customize the option. So a template does not have to be a generic template that you copy and paste for every single person. You really can customize
And
it.
we used to say it too, instead of just documentation, like if you get stuck during treatment,
Mhm.
we always say this in some of our other stuff, like
Doja Cat, and I'm going Salamander.
good to have your it's good to have it for our documentation. However, say you're working with this patient and they're just not getting it and you're doing different things and you're giving them cues and you're giving them guidance, but something's just missing. You can seriously go to the template and be like, oh, you know what? I missed that. I didn't look at if they were missing like this or if this was weak. I didn't test this muscle or you know what? I haven't tried that strategy. Let me try it. So it's also like for you, not just for documentation, but by writing all these things down, it just gives you the thing like, oh yeah, let me try that. And sometimes that's what helps too.
All right. I think we have a prize coming up. Okay. So as we mentioned, we're going to have a lot of giveaways. So everybody get ready to type in the chat.
A random winner that types in
oops.
that types in there. We have some like fun questions.
Okay. Oh, I don't. Okay. Oh, sorry. Our slides got messed up here. 1 minute. I was all ready for that giveaway. Sorry about that. Okay. Let's try that again. Okay. Sorry, everybody. Bear with us. All right, everyone, can we see that? I don't know what happened there. Okay, so what's one thing you like to do when you're not working? Okay, so we started off easy, so this isn't too challenging. This is just, we just want to know what you like to do when you're not working. Okay, everybody's coming in. This is an easy one. All right, awesome. I'm going to give about a few more seconds, and then we're just going to pick a winner. Okay. All right, let's see. Okay, Becky Morawski, swimming, you win.
So you want the transfer treatment guide. So after this is over tomorrow morning or whatever, just send us an email, thenoteninjas@gmail.com, and we will send you your transfer treatment guide.
Yeah, our transfer treatment guide has a lot of different strategies for transfers. It's not just how to perform this transfers, it's really just how to progress them, grade them, and then all the cues that you could be providing to really give that skilled care. All right, congrats, Becky.
Okay, so now we're going to show you how we streamline our documentation by actually building these templates. All right, so we are going to build the template together. We'll show you how we set ours up so you could do the same. So this is some of our basic templates that we like to have. We like to have some for patient goals, for patient presentation, and for showing your skill. Because we like to have these because when you document these things clearly, you're showing your skilled interventions, your clinical reasoning, and you focus on patient-centered outcomes, all the things that protect our reimbursement and the continuity of our care.
Okay, so the first template is patient goals. So templates of patient goals will streamline your documentation by ensuring that it's consistent, it's also going to save time, and it's going to offer clear, structured objectives. So they allow therapists to focus on personalized care by making goal writing quicker, while also feeling confident about adhering to regulatory compliance and okay, and just to make that you feel a lot more quicker when you're doing your notes and more confident. So let's see how we actually are going to be doing this.
Okay, so this is how we structure our goals. And this is basically the way you would structure any goal. So that's why we want to make sure we have all the compartments in there. We have who it's for. Is it for the patient, the caregiver, the family member, whoever it is, the skilled component, what we're working on, by how much and why it matters. And make sure that the why it matters always goes back to function, something the patient wants to do. So we input drop-down menus or lists that you can use for every patient, but can be personalized. Like we said, we have so many options to choose from that most likely it's going to fit with one of our patients. We might have like 20 or 30 examples in each drop-down menu. And of course, it builds over time as you do it, as you see more patients, as you learn more, you can put more things in those drop-down menus.
So an example for this type of template would we just use transfers. So for example, say Mr. Sims comes in for his initial evaluation, and he's an 85-year-old male with middle stage Parkinson's disease. He presents with increased fall risk, especially upon standing during the evaluation. You observe he is falling backwards in his chair during a 5-time sit to stand transfer. So this is a safety concern, and therefore you determine it as a goal to address that deficit. So you can go to the template, customize it for Mr. Sims, and then copy and paste it directly into your notes. So very simple. This is going to really save you hours. So this is really an example of what we could do. So we put in bold, like the type of transfer, the type of surface, and then these are interchangeable as well. So what level of assist do you want him to perform it at? And then what is that functional reason? And then how many days? So it really has every component that you need. And then you could be doing this with your patient, with whatever population that you see, whatever setting, you can customize it to, make it more fitting for your setting and patients.
All right, and now this is just how this is our evaluation master template. So this is how we set it up. We like to do it on a Google Doc because we can also use the guide on the side. So this way it's easier to find, especially once it gets a little bit more lengthy. So we have it by CPT code. We have it by drop down. As you can see, we have all the different levels. If you can just in your EMR, you can do this too. You can save it to that, or you can have it in the Google Doc like us. I like to see everything written out too. I like that way. And so we have it, as you see, CPT, the drop down, we have FOMs, we have the work balance, all kinds of different functional assessments. And we also have the task analysis. We have everything on there that we could think of.
Okay. So our second template that we want to be showing you is our patient presentation. So this is really going to help how the patient help document how the patient is performing the task. It's going to support clinical decision-making and treatment planning. It's going to improve communication, ensure defensible documentation. And templates are going to cover the limitations in any activity or exercise. And it's also going to promote personalized and precise care. So having a way that a template that shows the patient presentation. Like Stephanie was saying in the beginning, if it also can help lead our treatments as well. So maybe there's something that we missed, and then we look over at our template and we see all these different patient presentations, like, oh, maybe that's why, they're not being able to, get to that next level or decrease the assistance. Maybe they, so looking at that presentation can really help us determine and guide our next treatments.
Okay, so structuring the patient presentation again. So the structure of the template, you need to have the activity level, choose the functional task or strategies such as dressing, transfers, ambulation, and then you need to do a task analysis and patient presentation. So you have to really break it down, like how is the patient presenting? Are they missing barriers such as strength, range of motion, balance, posture, cognitive or perceptual limitations, coordination and safety concerns? You really want to go through everything. Like I said, this way it can really be more patient specific. And then you need to make sure you're organizing your findings. So like we said, we like to do it in a Google Doc. You maybe could put right into your EMR, whatever the way it is. It's just make sure it's organized and in the right spot.
Okay, so here's just a list that we kind of just picked for transfers. This is a very small portion of, what.
We're starting from square one.
Sorry, I muted. We'll take questions at the end. Just going to keep everybody muted. But here is patient presentations for transfers. So, decreased trunk flexion, all the ways a patient could possibly present. You want to list that there. That way you can, look at that and then once again, guide your treatments from there, guide your goals from there. And then it helps justify the assist level, show clinical reasoning, and really determine that medical necessity.
And now our third template is showcasing your skill. Because this is important because in the documentation, we have to show why we had to be there. Why does patient need the skill of a therapist and why couldn't a caregiver or a layperson do it instead? When we put our skill into a template, it makes our documentation quicker and it justifies the insurance why we're there. And we could keep that patient centered. And like I said again in the beginning, when you go back to it, like you might have forgot you did to do a certain strategy or to pick this, or maybe you're doing the same week for a while and one of your templates have, pick 1 rep max and it reminds you to do that, or all these different drop downs for a lot of the things that we use that maybe you just have to stick in the number or something very simple. But a lot of the words we write all the time are the same. It's just the small parts that are changing, which you have the drop down for, or you could always just write that small part in.
Yeah, so this is probably one of the most important ones because that's really going to be what insurers are looking for. Like, what is your skill that you are providing? So to structure it, we just have a bank of, you could do skilled phrases. That's going to immediately help elevate your notes by using facilitated, instructed, educated, guided, things like that, instead of just watched and, tolerated. We don't like tolerated. So you want to use those skilled phrases instead. And then cueing and guiding types, you can have all different ones you have a section for verbal cues and all different types of verbal cues that you can be giving, visual cues, commonly that you're using, tactile, all of those. And then you can even go a step further and really put those evidence-based strategies in there that you're using with your patients. And like the motor learning principles, 1 rep max testing, Borg scale, you can really put those in, and we'll kind of show you what we mean by that.
So this is how we would do it. Like we'd have a list of a verbal cue, auditory cue, and we just kind of bullet down all different things we could be doing. Then we'd have tactile cues and visual. So we would have this under basically all of our functional activities. We'd have, like she said, transfers, whatever, but you'd also have higher level balance things and functional tasks. And you can just label so many different cues, so many different guidance. If you use specific strategies, depending on what population you work at, you can just have all different ways underneath. And this just clearly shows the therapist input. It really helps justify the skilled care and it supports the safety progression in your strategy. So the other one was our evaluation template, and this is our treatment template. So we use the same really for our PT and OT. Some are a little different, but we have the same thing. We have it listed by CPT code or just by the functional activity. So we find different people like to do it different ways. So we have kind of a little different way of doing it for each one. But for gait, regular assist level, as you can see, the drop down we use for that, find that a little bit easier. But then we have the bulleted points, the patient presentation that we went over. How is your patient presenting? All the different ways and all these cues that you could be providing. And so you can see it's also so you can look at it like, oh yeah, I haven't tried that. I haven't tried that with this patient yet. So it's really, really helpful for the documentation and just for your patient care.
All right, I think it's time for another giveaway.
Need a giveaway.
All right, so what's your favorite functional balance? I can't see the question.
Activity.
Activity to use with a patient. Okay, so this is for the balance treatment guide. So this is one of our other guides that we have. We have a ton of balance. So use the chat, everybody. Go ahead. I know it's a little bit harder. We did a clinical question. Yeah, so our balance treatment guide, it shows a bunch of different balance exercises and then all different ways to grade it. And then we also provide PT and OT goals with it and a lot of documentation and a lot of other great resources in there. All right, so let's pick a winner.
Obstacle courses and clock yourselves down. I used clock yourself for so long. It's a good app.
Okay, we are gonna go with, we keep getting answers then, so then it keeps throwing me off. Okay, let's go with MJ, resisted gait multidirectionally. All right, MJ, you are the winner. So make sure to
More
email us.
answers. Nice.
Congratulations. Yeah, thanks everybody for those answers. That's awesome. We love to see everyone's ideas too. They're all very great.
Yeah, you guys should scroll through.
Yeah,
something.
scroll through some ideas and jot those down. All right, awesome. I think, oh, and we have another giveaway. We did 2 back-to-back here. So this one is for our ADL treatment guide. So how old was your oldest patient you ever worked with? I think I had a 140-year-old patient. I think that was my oldest. 104.
104, maybe. That guy
I got a lot of
that lived by the beach.
105. Wow. All right. I'm trying to get to, let's see if I can find the one that had the oldest. 106 was Justine's iPhone. Wow. Okay, Justine's iPhone, you win.
And we're going by the
Oh,
old.
I saw so. Wow, 108 was
108.
crazy too. All right, congrats, Justine's iPhone. You won. Just make sure to email us and we will give you the ADL treatment guide. Wow, 108. I can't imagine. Okay.
All right, so now we just lay out the foundation of our template system. We showed you how to build the documentation template, and we showed you 3 different templates: the goals, patient presentation, and showing skill. Now we're focusing on showing skill and customizing those templates that we have, and customizing to show your skill and then show our sensibility.
Okay, so good documentation doesn't start at the end of the session. It really starts at the beginning with a clear plan. And templates, they don't make your notes cookie cutter. They make them skilled, organized, and faster without losing your clinical reasoning. So the key components, there's 3 key components that we want to be showing, and that's function focused first, clinical skill language, and progressions and modifications that are built in. So we'll be using balance throughout just as an example, but you can really, apply this to any of your goals that you're working with.
All right, so we have function first. So you always want to tie your activity to a real world tasks. So here's the thing. We can't just say we worked on balance and call it skills. That's not going to cut it. If you want your note to actually show skill, you've got to connect it to something functional, something the patient needs to do in the real life. So instead of saying worked on dynamic balance task, you could say something like to retrieve items from the floor, or to simulate pivoting in the kitchen, or to improve safety with toileting tasks. That's what makes it skilled, and that's what shows your reasoning, and that's what makes it reimbursable. So just think, what is this balance task helping to do outside of therapy? And that's what you need to document. So we have some examples. Patient completed dynamic balance activities to safely remove items from the floor, and patient engaged in standing, reach, and pivot tasks to simulate kitchen activity. So remember, insurance doesn't pay for it unless it's something related to their everyday life, something the patient wants to get back to that they need to for their functional activities.
Okay, so clinical skilled language and showing your guidance and adjustments. So when you're documenting, it's not enough to say that your patient did an activity. You really have to show your role in it. So that's why having these strong action words like guided, facilitated, or adjusted makes it clear that you weren't just watching, that you were actually actively involved and making clinical decisions in real time. So it also helps to justify why therapy is medically necessary, why you need to be there. So if you're cueing, modifying the environment, or using manual techniques, that shows the patient needed a skilled therapist, and it's not just something that they could either do on their own or with an untrained staff. So that is key. And finally, it also protects you. So when you clearly document how your intervention has impacted the patient's safety, their progress or function, you're really creating defensible notes that hold up in audits.
Enjoying a little bit of downtime after all of the.
Okay. So some examples here. So guided patient through anterior weight shift with tactile cues at hips to promote safe sit-to-stand mechanics. Facilitated scapular stabilization engagement via tactile cueing during reaching and standing to support upper extremity control. So you're not saying patient did a reaching activity. Patient did sit to stands. You really need to show your skill through that, because we've looked at a lot of notes and a lot of people miss that skilled component. And so we can't tell. Like if we were auditors, we would probably flag that chart, and then, it might not be able to be upheld in court. So you might get denied. So this is why it's really important that you really need to be, showing your skill and using those skilled phrases in order to justify your skilled care.
All right, and also for progressions and modifications. So we can't just repeat the same exercise every session. If we're just checking it off every time, then it's just copy and paste basically, and that's not gonna do it. So if we want our treatment to be considered skilled, we have to show how we're adapting it. That means clearly documenting how you're grading the activity, whether we're making it harder or scaling it back based on the patient's needs. We have to always be showing this. Basically, we have to be showing like how our brain is working and how we're adjusting things for our patients.
Okay, so just wanted to show you the template again, just to, now that we talked about it a little bit more and we went over, like our components, we just wanted to show you, once again, what it looks like. So here it is. Once again, we have like those task component activity examples. We have all the cues, the patient presentation. We do have that phrase that can be interchangeable. Okay, time for another giveaway. All right, so what did you think of the summit? So just give like one word to describe it. We'll give a good adjective. All right, and this is for the functional assessment guide. Excellent, insightful. Yeah, thank you. We love hearing it. Yeah.
I loved our presentations. Truthfully, they were all people that like we love listening and we love following. So that's why we asked them.
Yeah.
But then we were nervous to ask. So they're really good presentations.
Yeah, we really did. We really handpicked every single person and reached out to them and, really thoughtfully put this together. So we're, already thinking of our next summit for next spring. So if there's any speaker that you're interested in hearing from for next year, just email us and let us know, because that would be, or if you want to be a presenter yourself, please reach out to us. We'd be happy
See a
to.
specific topic person you.
Yeah. Perfect. All right. Picking a winner. Let's see.
So we had some
All
fun.
right. Brian I can't say your last name. McCullough.
know.
Brian, who
Yes,
says
you're-
fantastic. You're the winner. All right. Congratulations, Brian. You win our guide. So make sure to email us, thenoteninjas@gmail.com, and we will send that your way. All right. I think we have another giveaway.
We did put extra ones in.
We did. We put all of them in. All right. Tell us what strategy you've put to use already. All right. So if you haven't started the summit, you might not be able to answer this, but we got clock yourself.
Started then.
And this is for,
as I said.
our balance treatment and documentation library. So this is actually a section taken from our membership that we, provide as a standalone product. It's all about balance. We have a lot of different sections on there, evidence-based practice. We have different treatment ideas, documentation, everything. So,
Let's clock yourself.
wow. This is actually really exciting to see everybody.
I think I showed you the clock yourself app when we worked
You
together.
did. You did. Stephanie actually introduced me to the Clock Yourself app back in I don't know, 15. All right. A lot of clock yourselves. Okay. That was JJ Matter. All right. Robin sorry, I'm butchering. I should really butchering these last names, but Robin, you are the winner. Congratulations. All right. Awesome. So you win our balanced treatment documentation library. Make sure to email us and we will send it your way. Oh yeah, and make sure when you email us, let us know what prize you won if you can remember, or else we'll have to go back and look. Okay. Oh, we have one more giveaway. Actually, we made another one. Okay. Do you think this will transition us to our next training? Do you think AI has a place in healthcare? So this is it's a, yes and no question, but this is for our 4 treatment pack guide.
Yes, than I thought.
Yeah,
Last time we asked this a lot in the
absolutely.
news, but it's coming along.
I love AI, of course. Yes, respectful to use hesitant. Yes. All right. Awesome. Thanks for sharing that. We always we're very interested in seeing that because
It's rough.
okay, and I will pick a winner. All right, Shelly. Shelly answered yes. Shelly, you are the winner. All right, congratulations. You won our 4 treatment guide, our bundle. And all right, let's get into our next training.
All right, so now we want to talk about AI because yes, it's everywhere and it can be helpful. However, you have to know its limitations and but also be able to use it correctly. So the problem is that a lot of generic AI doesn't understand like our clinical context. It doesn't know what makes something skilled. It doesn't always know the strong medical necessity language. It doesn't know our scope or what matters in an audit. So it can kind of give you little fuzzy things. You have to, when it gives you the answer, you really have to know if it's right or wrong because it's not always right. And we've tested a lot of these tools and some of the notes they generate are honestly a little scary. I've seen AI suggest the wrong leg to going upstairs. Like I said, like somebody had a knee replacement and like just going up and down the stairs. What leg should they do first? And it seriously said the wrong one. So that's just like basic PT like 101. So some things can be wrong and it's told me a lot of other things too. I put in there like, are you sure this is correct?
They also like to say that OT does arms and PT does legs.
It gets so mad.
Yeah.
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 So it does not it's correct. And a lot of times they'll say, are you sure that's right? And then they'll say, oh, you know what? Looking back, or there's no proof of that, or something like ridiculous. So
So. So we want you to use AI as a tool, not a teacher. So this is something that we heard, and I think that it just resonates really well, and it goes really well into our field, and kind of just showing why AI isn't really enough on its own yet. Maybe one day, but it's not going to replace us. So don't worry. I think especially anyone in healthcare, like you're not going to be replaced. Maybe the tedious tasks of what we do, but it still has a long ways to go. So before you jump right in to start using AI for all your notes and treatments, you really just need to proceed with caution. Okay, I think I did this last night. Okay.
Oh.
Sorry. My notes got. Okay, sorry. We're gonna back up. This is how AI can really help. So it's gonna help you save time. It can help you write notes faster. It's gonna do some less repetition. So can reduce typing the same thing over and over again. It can help remind you what to say with prompts. It's always prompting the next thing. So it's always on to the next thing. And then it's gonna help make your notes stronger so that you can write the right things that hold up in audits. Okay. All right, but you want to proceed with caution.
all right, so now we have this one. Unless you want to go back.
Is it
So-
good?
all right, so you have to go into the membership.
Oh no, this one. So this is why most AI tools fall short in therapy documentation. So AI isn't inherently skilled. It doesn't have a doctorate degree, it doesn't have its master's degree. And so it really doesn't replace clinical judgment or skilled decision making. It lacks PT and OT clinical context because generic tools don't really understand our scope or patient goals. Like I said, it still thinks that OT only treats arms and PT only treats legs. So that's a very big red flag there. And it misses functional relevance because it can fail to tie activities back to real world tasks or progressions. Also, another thing I'm going to add is that AI acts really, really confident. So you might be, convinced that this is the right thing, but it's really, you really need to use your clinical judgment and understand whether or not that actually is accurate. It also can use, it uses vague, non-defensible language, phrases like tolerated well, that it does not hold up well in audits. We have talked to risk management consultants. I got,
It does like tolerated well.
Yeah.
Really gotta train that.
Yeah, the thing about tolerated well, I'll get on a little bit of a tangent with this because I posted something on TikTok about, when patient rate, or a therapist rates tolerated well in their notes, don't do that. The reason why you don't want to write just tolerated well, I could, it is okay if you're putting context to it. Patient is like has low endurance and however they tolerated this session well, and then you're continuing on to show your skill with it. That's okay. But when you're just writing tolerated well and nothing else, like that's when it becomes the problem. And AI does like to put tolerated well in a lot of examples. And also it could potentially put your license at risk because notes that sound good, but lack justification are going to be leading to denied claims.
Also make sure, especially if you use ChatGPT, and I'm sure other ones too, if you're looking for research, it'll make up research a lot of the times. I tried it a couple of times and then we put it into like Google to look and it didn't exist. So it's not, so just be aware. Like we said, it's really good and you can come up with ideas, but you just have to always double check things. And that's why I don't think it's ever going to take our jobs, at least not anytime soon, because we do have to know actually what's right or wrong. And even like when your kids use it in school, I always told them this too. I'm like, it might not be right. Like you got to check your answers. So just so you know it, none of it's right. All right. This one.
Yeah.
All right. So now we want to be our Note Ninja AI clinical assistant. So we're going to screen share this for you in a minute, but we did customize an AI. So like we said, we've ChatGPT, it came up with crazy answers. We found one that we could customize with our own information, our own words, everything from our membership, our treatment guides and everything, and go in there and we train it to use certain words and talk a certain way. So we'll show you a little bit about that because they really need to be trained. That's the main thing to get away from. If you're just like using, especially if you're using like a free version of one of those things too, it doesn't remember anything and it's going to forget what you told it. So you really have to train it on like the treatments you do, the right verbiage, with like the documentation. We always put like the Medicare guidelines in there, like all that kind of stuff. It has to be trained good.
Okay. So yes, so like Stephanie said, we have a Note Ninja clinical assistant or AI clinical assistant that we use, and we used all of our, we've trained it on all of our trainings, all of our information that we share through both, our paid and free resources. So it really is trained to spit out an answer like us. So let's say we can't share it because. Okay, we were going to share it, but we cannot because we had technical difficulties before, so we had to switch computers. But all of you should have been given access to the Note Ninja membership with, we had that 14-day or free trial. So once you go into the membership, you can go to the AI assistant and then you can play around with it yourself.
It just says like, ask me a question. You can put anything in there and it just comes up with different ideas. You can have like different treatment ideas, what you can do for balance, what you can do for a patient with Parkinson's. You could be the more specific, really, the better. You'll get more activities. A patient with Parkinson's that treating for freezing or, stuff like that. Or it can help you with some like note ideas.
Like Christy using it to prepare for sessions. Yeah, that's a big one, definitely to like, especially like a complex patient that you have coming up.
I'm just
like,
gonna gather this up for you here.
So yeah, so it's, make sure that you're checking it out and you're utilizing your free trial if you haven't already. to get the most out of it.
And let us know if you are checking it out too, and like what you see, and if you think it's giving you good or bad answers, because we do go in there, and our clinical specialist that's answering some of your questions, he goes in there too, so we can help train it. We like to go in every couple of days and just really just look at it and make sure it's giving the right answers, referencing the right stuff, being specific enough. But any like tips that you guys give us too when you try it out, let us know, because we can help train it to like be more specific about certain areas too. We found it off.
Yeah. Oh, yes. We also included the AI training video of just kind of how to use it and prompt it, because I know it can be a little bit confusing, and some people, are maybe not utilizing it for, in the right way. So we just put together a really quick video with just some ways to prompt it better.
But you did have that 2-week free trial, which you could always do again too.
Mm-hmm. There could even be a template for prompts for AI. Yeah, absolutely. We do have a small download for it, but yeah, we could definitely do like a template for that too as well.
Wow, good template.
All right, so now we're gonna go into our winner for our scholarship.
Oh, your wheels on your.
Yeah, so
computer.
okay, so we have a wheel. I wish I could show it to you.
She did it so she could screen share, and then we met.
I know. Yeah, my computer was not showing my
Yeah,
slides.
we
All
have it
right,
going.
here I can. Here, wait. Ready? Everybody can see. So it's all right. Ready? This is for our scholarship winner.
So it's the year of the Note Ninja membership, and you're gonna have the AI tool, and you're gonna get those our master templates too. So
All right, Charlie Rollinger. I don't know if you're in this or not. Charlie Rollinger. I'm gonna type the name. Charlie. Are you here, Charlie? You don't have to be here to claim your prize, but it is more exciting when you are. All right. Well, congratulations, Charlie. So you get the annual Note Ninja membership. We will reach out to you and set you up with that. Awesome. And also thank you so much for everybody who thank you for everybody who filled out that application. It's really, we really love to read all of those. And I honestly, I was like, can we give it to this? This is why we had to do it random, because we didn't want to pick it based on, we just wanted to just make sure that.
Nicole went in the rabbit hole of reading all the answers.
I did. I went on a rabbit hole of reading all the answers. I'm like, everybody really deserved it. So yes. So, congratulations, Charlie, you win. All right. So if you didn't win the scholarship, it is okay. We are giving away we have a summit only special for you. So it's with the Note Ninja Annual membership, you will get the actual R Master documentation templates free with the annual membership. You'll also have access to the AI clinical assistant, and you're also getting those 3 free months. So 12 months for the price of 9. So that's our big summit annual special for our membership. So as just a thank you for coming on and, joining the summit, we want to continue your learning. And this is a way to, not only are you getting the membership, but you also are able to go into our private group, our private community, the membership community, ask questions, brainstorm with each other. So that is our summit special. Here are our QR codes. So you're also, some of you have asked, we kind of got ahead because, last time some people have asked just for the templates, not the membership. So the QR code on the left is to join the membership you're also going to get that templates free with the annual subscription. So only with the annual subscription, not the monthly, you'll get the templates. If you just want the templates, so you will have lifetime access to those templates with no subscription, no membership. So that's just the difference there. So if you just want the templates and don't care about the membership, then do the templates. But, the membership is a really great resource. It has tons of different categories in it. We have that
Videos
community.
are nice to look at. It has short videos with progressions, ways to document examples, different modifications. And we do add to it monthly with what our members want to see. So whenever people ask us, we always try to get it done. Either we do it, we have our clinical specialist on there that does it, or we'll try to reach out to someone if it's like a really niche specialty that we want like more direction from. Or sometimes we'll bring on a speaker too to talk more about a specific area. So
Yeah.
we do
And
that.
the templates are in a Google Doc, so you really can just we show you how to make a copy of it so that you can customize it yourself, and then you could put it into whatever EMR system that you have. So we've actually partnered with Jane in the past, and we've put our templates into Jane very easily. I know they work with Raintree. You have to do a little bit on your end to like copy and paste and upload them into there, but they really could be utilized, I think, within any EMR. All right, so we just want to give a special thank you to all of our speakers again. They were really incredible. Once again, please, reach out to them, tell them if you really like their presentation. I'm sure they would love to hear it. Tag them on social media. Yeah, we really could not have done this without them. Once again, if you want to speak next year or you have somebody in mind, please reach out to us and let us know. Yeah, or a topic that you want to hear about too. Okay, so I'm just going to put the QR codes back up so you don't miss out on those.
So when I used mine, I was able to probably I put in some of it in my EMR, and then sometimes I just kept the Google Doc open and copy and pasted like what I wanted into it. Sometimes you can save it as a drop down. And Jane, I think we saved it as, I think it was just a template though, but we just kind of just copy and paste the whole thing right in. Some have a drop down, you have to add it to, right?
Yeah,
Couple that
yeah, you can like
sometimes.
customize your, customize the drop downs within your EMR. That's the thing. There's so many EMRs out there. They're all built so differently. So we really wanted to make a template that could be utilized across any EMR. So that's why we put it in a Google Doc. That's why you could open it from I open it from my phone. We have that, the search feature in there. It's very, pretty easy to navigate from there.
And this way we can also update it too. Like we also update that if somebody has something specific they want to see. I think we just added a bunch of stuff pretty recently, but we can add to it. And you always get the updates too. Every time we add to it, membership or the templates, you get the updates. So.
Yes, absolutely. All right, thank you, Gina. We appreciate that. So anybody have any other, we could stay on for a little bit, and if anybody wants to, ask a question, we're happy to answer.
Glad you guys all love the summit. We seriously loved putting this together. It was the first one we did. We were a little nervous because we talk, but to ask other people, like present, but I think they all did a great job, and it was fun to get a lot of different people together, because everybody has their different niches. Some people really neuro, some people hand, and it's fun to really get different specialties and hear how they do it. And we really wanted a specific activity with how they document it. So we were very specific when we told them how to do how we wanted the presentation. And I think they all did a great job of it.
Yeah,
so,
yeah.
I don't know. Hopefully everybody else thinks the same thing, but it seems like it. So that's good.
Oh, thank you. We love hearing that. Thank you. We love all these messages. They really
at least a year. We say a year, but I mean, most likely we're not going to take it away. Unless if something were to happen to us and it just disappeared, but otherwise you're going to have it. But do pay attention to the dates. I think I put it in the summit. I know it was on our sales page. Let me make sure it's in the beginning of the summit too. Because for OT, it's good. The CEUs are good for 5 years, but PT is super annoying. So all the states are a little bit different. The earliest one to expire would be New Jersey, and that would be the end of January when our license expires. That's the first one, because that's just the way they go. They go by 2 years from when we get our licenses to renews. So they're all a little different. That's the first one that will expire, but just really pay attention to that, because you have to complete it and take the quiz to get your certification before like the CEU time is up. So it's just something to like be aware of, but you will have access for a while. It's just make sure you get the CEUs in time if you are here for that.
Yes,
I'll make sure that's
Good
in there. I
point.
think I put it in there, but I'm
You
gonna
did.
double check. I did, right?
I think so. Yeah, and I just put the login too for anybody who had signed up for the free trial or has a membership. So that's the link. However, you can go to our, one second, if this is on my computer, you can go to our website, www.thenoteninjas.com, go to the top bar, click on more, go to login, and that's how you can get in every single time. We try to put it in all of our emails to the login link, but if you really need quick access, just go to thenoteninjas.com. Easy enough.
I get the job yet?
Yeah, you can also download the Kajabi app on your phone, and then you can log into your library from there. I would show you, I don't know.
Especially since this one's a lot of talking for the summit stuff. You can listen while you're in the
Yeah,
car
so
going for a
it
walk
pulls
or
up all
something.
your products in there. You could pull up the membership, and then it's all the same, just a little different. Doesn't have our pretty thumbnails on there, but yeah, very, very convenient. All right. Any other questions? I'm gonna stop recording.